So up to now we have seen the anatomy of the carotid triangle. Out of these 3.5 triangles, the submental, the digastric, the muscular triangle and the carotid triangle, we have seen the detailed anatomy of the carotid triangle. Now we will see the anatomy of the digastric triangle. The digastric triangle is the triangle which is formed between the two bellies, the anterior belly and the posterior belly of the digastric muscle, as the name tells about the muscle. The two gastric bellies, muscle is having two bellies. The posterior belly is coming from the digastric notch of the mastoid process, and the anterior belly is coming from the digastric fossa of the inner side or the symphysis manti of the mandible, and inserted through intermediate tendon in a fibrous pulley on the hyoid bone, which is situated here. So the digastric triangle the posterior belly of the digastric, the anterior belly of the digastric, the mandible, so here we can see the mandible. This is the base of the mandible. The fibrous pulley, intermediate tendon of the digastric and the hyoid bone is here. The posterior belly of the digastric, the ear, and this is the mastoid process of the temporal bone. So base of the triangle is formed by base of the mandible, the projection of the angle of the mandible on the mastoid process. So an imaginary line extending from the mandible up to the mastoid process. Posterior-inferiorly it is bounded by the posterior belly of digastric, and antero-inferiorly it is bounded by the anterior belly of the digastric. The apex of the triangle can be seen on the hyoid bone. So this is the posterior belly of digastric muscle, the anterior belly of digastric muscle. The triangle is situated here, that is the posterior part of base of the mandible, this part, and this part is specially named as the submandibular region, and the posterior part of the digastric triangle is related to the parotid region. So triangle is divided in larger anterior part and smaller posterior part by stylomandibular ligament. The stylomandibular ligament is running from tip of the styloid process to the angle of the mandible. So this is divided in larger anterior and smaller posterior part. This part of the triangle is mainly having the superficial part, not deep part. Deep part is deeper to mylohyoid muscle. So this part is having superficial part of submandibular salivary gland. So this is the stylomandibular ligament, which is separating the submandibular gland to the parotid gland, and stylomandibular ligament is modification of investing layer of deep fascia. So here the investing layer of the deep fascia from the hyoid is splitting in a deep lamina and a superficial lamina. The deep lamina is covering the medial surface of superficial part of submandibular gland and attached on mylohyoid line. So splitting of the two layers of, this is the section of the mandible, and from hyoid splitting of the investing layer to enclose the submandibular salivary gland. So splitting is from here. The deep lamina is covering the medial surface and attached on the mylohyoid line. The superficial lamina is covering the inferior surface and attached on the inferior border or base of the mandible. The superficial part of submandibular gland is having two ends, anterior end and posterior end, three surfaces, medial, lateral and inferior surfaces. The anterior end of the superficial part is related to the posterior belly of digastric, and posterior end is related to the stylomandibular ligament. The medial surface, lateral surface and inferior surface are related to some other structures, like the lateral surface is related to the medial pterygoid muscle, the medial surface of the submandibular fossa of the mandible, and the descending cervical part of facial artery. The lateral surface is related to the mylohyoid hyoglossus muscles and some other structure, while the inferior surface is related to skin superficial fascia, deep fascia. This part is having some other structure also. The wedge-shaped submandibular fossa and the digastric triangle are having the superficial walnut part of the submandibular salivary gland, and it is also having the facial artery. The facial artery, a branch of external carotid artery, and it is having S-shaped course. The course is like this. So two loops are formed. One is the upward convex and downwards concave for the submandibular gland, and summit of this is approaching up to superior constrictor muscles of the pharynx and the fossa of the floor of tonsillar fossa. So course is like this. The posterior end is grooved by ascending cervical part of the facial artery. So course of artery is like this. The artery is taking about the greater cornea of the hyoid, and initially it is resting on middle constrictor muscles of the pharynx, then ascending upwards from the posterior end of the superficial region of submandibular salivary gland. The summit, this is the summit of this first loop, is resting on superior constrictor muscles and floor of the tonsillar fossa. Here it is giving two branches. Ascending palatine and inferior tonsillar. In this region it is giving two branches. The ascending palatine and inferior tonsillar. While in this region it is giving the submental gland, which is entering in submental fossa. So it is superficial part of submandibular gland which is separating the facial vein from the facial artery. Here facial vein is superficial and facial artery is deeper to the superficial part of submandibular salivary gland. So vein is superficial while the artery is deep to the submandibular gland. This is the facial vein and this is the facial artery. This part is also having lymph nodes, the submandibular lymph nodes. Clinically these lymph nodes are very important and enlarged in the metastasis of the cancer or in some infections. These lymph nodes are lying deep to the investing layer of the fascia and adherent to the submandibular salivary gland. Lymph nodes. These lymph nodes are draining lymph from the middle part of the forehead, the nose, lateral side of the nose, the part of upper lip, lateral part of lower lip and part of the chin, and anterior 2/3 of the tongue except tip of the tongue, which is drained by the submental lymph nodes, and it is all these lymph nodes are also receiving efferent from the submandibular lymph nodes, and efferents from the submandibular are drained in the digastric and omohyoid lymph nodes, jugulodigastric and jugulo-omohyoid lymph nodes. So the contents of submandibular